Together with the scientific committee, we are pleased to present this year's conference theme, Advancing Access to Safe, Affordable and Timely Surgical Care. This theme underscores our commitment to promoting global surgery in Uganda and fostering collaborations with all international surgical initiatives.
Now, if we limit ourselves to repeating what's been handed down to us, no matter how meticulously we do it, no matter how many patients we treat with these established methods, we do ourselves and our patients a disservice. So let's not settle for the technician role, grand as it might be. Let us also become the teacher, the educator, the innovator, the scientist, the researcher, the patient advocate. All these are our roles as surgeons.
The practice should change, but most important also the policies. Does our curriculum in surgery actually ask the resident to understand statistics? We might still be researching on things that are for the 20th century.
But one other thing that stands out very, very clearly why we have a gap in advocacy is we don't put price tags to our things. Now, the people who sit in those boardrooms and make decisions, there's something they look at before they make a decision. The same thing you do when you go to a shop and you look at a nice shirt or a nice top and you want to buy it. What do you do last before you make a decision? Price tag. So we make these arguments, but we're not putting price tag. The guy in the boardroom is going to ask, how much does it cost to have an anesthesiologist? And if no one can answer that, that might...
All the children who are under maybe 15 years constitute more than 50% of the population. And we can't claim that all these children could come to Mulago for treatment. So we realize that unless we spread out to all regional referral hospitals, probably that's when we can try to address some of these conditions.
I don't think we have a surgical problem. We have a leadership problem. So we need to think about the stories and how we tell the stories to our society.
We need trauma surgeons. Please do some training in trauma. Trauma is taking its toll on Ugandans.
Get a lot of advice from a lot of different people, a lot of different mentors. Oftentimes you will have a mentor for your clinical work, sometimes for research.